Health inequalities in the antenatal period arise from the experience of adverse and complex social factors. These can potentially increase the risk of illness, complications, or even the death of the mother or baby, and result in poorer long-term maternal and child health outcomes. Problems often arise from the interconnected web of deprivation and health inequalities. Many pregnant women have what are known as complex social needs, where several risk elements are at play. Pregnant women who are at risk from complex social factors may misuse alcohol and/or drugs, may be recent immigrants and/or have difficulty reading or speaking English, may experience domestic abuse, may already be known to social services or child protection services, may be unemployed or live in a deprived area, may experience mental health problems, or may be teenagers. Deprivation in pregnancy is associated with greater exposure to risks for poorer outcomes, such as smoking during pregnancy, unplanned pregnancy, and planned bottle feeding. Infants who are born to women who experience complex social factors are at higher risk of death or illness, preterm labour, growth restriction in the uterus. Low birth weight, low levels of breastfeeding or no breastfeeding at all, and higher levels of neonatal complications. To counter such issues, early years services promote access to antenatal care. Women who have socially complex needs in pregnancy may not necessarily attend for their first antenatal booking appointment later than women who do not have such needs. However, they may require greater support in order to be able to establish and maintain contact with antenatal services. Good communication and relationship building between them and their care providers are key to helping them get the best from services. Early access to antenatal care is important. However, access is not just about physical access to antenatal booking at a particular place and a particular point in time. It is about the quality and impact of ongoing access to and good relationships with antenatal healthcare staff. Access is about responding to the individual needs of women, whatever their social circumstances. Continuity of carers and the development of trusted relationships should be provided to ensure the safe care of women with complex health and social care needs. The key factor in ensuring that women continue to engage with antenatal services is what is known as continuity of care. It's reassuring for a woman if, at each appointment, she meets the same health professionals. This allows the building of an ongoing relationship and eventually trust. All of this has been proven to enhance communication between the woman and the antenatal care team. For women under the age of 20, continuity of care may help to maintain their ongoing contact with antenatal services. For women experiencing domestic abuse who may not disclose their situation during initial appointments, an ongoing relationship can facilitate disclosure and referral to specialist support services. Women with drug or alcohol problems are more likely to continue engaging with antenatal services if they are consistently attended to by a named carer who has specialist knowledge or experience. Similarly, continuity of care helps staff to understand the religious, cultural and social differences of women who are recent immigrants or who do not speak or understand written English easily, and this in turn can help them to support these women as they navigate their way around the often complex NHS systems. The key element of antenatal care for women with complex needs, then, is the provision of continuity of care, which leads to a relationship of trust. As with so many other aspects of the early years services, this depends on the high level of interpersonal skills of support staff.